ago, my sister was admitted to the hospital with an ear infection and was prescribed a very standard, very run-of-the-mill antibiotic. 16 days later, she passed away from drug-related complications. Now, this story is not special and it is not unique. Complications from drugs are the 4th leading cause of death in the United States. My name is Tasha, and I'm the CTO of Droice Labs. I'm joined here today by our CEO, Mayur. And we are a healthcare company that uses artificial intelligence to help doctors choose the right treatment for each and every patient. Because we know that for people like my sister, getting the right medicine can mean the difference between life and death. So I'd like to take you through the clinical process so we can understand why this happens. Let's just say that you have some sort of medical problem, perhaps a chronic cough, shortness of breath. So what you do is you go to your doctor and describe your symptoms. He or she may ask you some questions, look at your medical history, and if need be, take some labs, tests. In this case, maybe a chest x-ray. Now, after considering this information, the doctor can make a diagnosis. Maybe you have asthma. And it's at this point that the doctor needs to give you a prescription so that you can manage your condition. And in this clinical process, this is the step that often causes so many problems. And the reason for this is that there's a lot of information the doctor has to consider. First, there's data that's very specific to the patient. Every single person is unique. And this has many factors like your age, weight, sex, medical history, family history, genetics, susceptibilities. And these are just to name a few. There are many, many more. Additionally, the doctor has to take into account specific things about the particular treatment. For example, has this drug been tested extensively on children, for example? Does it work well on diabetes if you're a 45-year-old woman versus a 65-year-old man? Things like this. And after taking all of this into consideration, the doctor inputs this into a very complicated medical decision tree. And at the end of each of these branches is a possible treatment. Now, what I'm showing you here is actually a fairly simplified tree. There are often hundreds of options here. And even after narrowing them down, based on the information about the patient and the treatment, there are still often 15 to 20 possibilities left. And I'd like to emphasize that doctors are very good at this. They're highly trained to do this. But it's impossible for a doctor to have seen every type of patient that exists. So in the end, the doctor makes a prescription. They choose some sort of treatment for this patient. And a couple things can happen. In the best case scenario, the patient gets healthy, the treatment is successful. However, in a slightly less ideal scenario, the treatment may be a little bit less effective, maybe the patient doesn't get better, may even get sicker. And in the worst case scenario, very serious complications can occur, like surgical complications and adverse drug events, which can result in serious illness or even death. Now, these two cases here account for roughly 15% of all prescriptions in patients, but take up over 60% of all healthcare costs. Our mission at Droice is to reduce this 15% by putting the most accurate, clinically relevant information at the fingertips of every doctor. This will help the hospitals not only save money, but more importantly, save lives. So what do we do at Droice? At Droice, we provide a platform that lets a doctor see how any given treatment, be it a drug, medical device, or even a surgery, and see how it will perform on the individual sitting in front of the doctor with extremely high accuracy. This includes things like the chance that the treatment will succeed, will it get the patient healthy, as well as predicting risk factors and complications. And these can be as innocuous as a headache or as serious as something like organ failure. Additionally, in order to make our insights actionable, we can predict when these events may occur. If you're going to get a kidney failure, is it going to happen in 12 hours or 24 hours? Our platform enables doctors to help get patients the care that they need when they need it most. Finally, we strongly believe that artificial intelligence should not be a black box. We know that doctors should understand why we're predicting what we are predicting. So we back every single prediction that we make by trusted scientific literature. And to make these predictions, we have a tremendous amount of public and private data at our disposal. This includes over 10 million individual patient health record that we've obtained from our partner hospitals. And we take this individual patient information and marry it to quality sources of public data, like clinical trials, medical research papers, and drug information. And what we do is we take this and plug it all into our AI platform, which uses state-of-the-art natural language processing and deep learning algorithms in order to make these predictions in our treatment strategy support system. So what I'm going to show you now is an example of how our product works. What we actually provide is a software that we provide that doctors can integrate seamlessly into their workflow. So in this case, what we have is a patient, let's just say with diabetes, but perhaps the treatment is not very effective, and so the doctor wants to make a switch to the medication. So after logging in, at the left, you can see a bunch of treatment options that have been prescribed to similar patients in the past. On the right, you can see the efficacy of these treatments, as well as citations linking it to relevant literature from PubMed or clinical trials. So the doctor can scroll through all of these, weigh their options, get some information, and then choose a treatment. And after prescribing a dosage and a frequency, what you can see here on the bottom left is also the chance of adverse events or complications occurring from this drug, what they are and how likely they are. Finally, if these events are very serious, we provide a warning explicitly to the doctor. So what goes into these models is pretty complicated and requires a lot of science behind it. But essentially what we are doing is taking from millions and millions of previous patients in the past and trying to learn patterns about how these adverse events or treatment success may occur. For example, for a given patient, there could be hundreds of these factors that actually mean that this person's susceptible to a kidney failure. And for another patient, this could be something, a completely different set of factors from a stroke. And so the goal of our technology is to learn these types of patterns and make sure that they're available for every patient.
So what Tasha talked about are two things, algorithms and patterns. These are highly complicated algorithms which we have developed in-house and patterns which we have recognized in millions of patients. Both these things are maintained in the company as trade secrets. We do not provide these algorithms openly to our customers. What we provide are predictions wrapped in software. Also, these algorithms are learning algorithms. They get better every time a doctor uses them. Every time we sign a customer, that is a hospital, we get millions of patient records from them. For any competitor to come and replicate us, that's a very strong barrier to entry. Further, since these are learning algorithms which keep getting better as they are being used, for any competitor who's trying to replicate us, they have to get the treatment performance data. That is not data they can just buy. The product has to be used to get better. That's another serious barrier to entry, and they have to get through this time to reach the same efficacy standards as our product. Efficacy is very important. Hospitals don't buy products which don't have a clear efficacy attached to them. On that note, let me introduce you to our clinical trials. So we took these technologies, we went to 2 hospital chains, 600 doctors. We split them into 2 groups, 300, 300. To one group we gave the technology, to the other we did not. And then we monitored individual patients, similar patients, the 2 pools, and we saw how they are being treated. What we found was fascinating. We reduced the length of treatment, that is the time it takes to treat a patient by over 10%, the time it takes to get a patient healthy by over 10%. We also decreased the complication rate, things like heart failure, kidney failure, and organ failure by over 15%. Overall, both of these things alone mean decrease in average variable expenditure on a patient by over 7%. What does this mean to the hospital? Whenever a patient walks into a hospital with a certain condition, the insurance companies pay them a fixed amount, depending on the complexity of the case and so on. If a hospital can treat these patients faster, better, then they are directly saving money. If you decrease the length of the treatment, you are directly saving dollars out of their pocket. And in this extended unit, this time you have saved, they can see more patients. That is, their revenues go up. In the 3 months we did this trial, we saved these hospitals over $1 million each. This brings us to our market sizing. We work in highly complex cases. We are not for every patient, but we are at cases which are complicated when the doctor is actually looking around treatments and thinking what to do. We are also a big data artificial intelligence company which works with high prescription volume conditions like heart disease, COPD, asthma. Combining the current market research with our clinical efficacy of 7% reduction on variable cost of a patient, our market sizing comes out to be roughly $4 billion. This brings us to my business model. The business model is very straightforward. We go and sell this product directly to hospitals. They get better patient outcomes, they get increased revenues and better savings, and in return, we get a subscription fee. After extremely successful clinical trials, we close the contracts with these hospitals. These are heavily discounted contracts, and it is simply because these are the same hospitals which help us do the clinical trials. Our technology is also being used by another major US hospital IT solution provider. We also have signed partnerships with other hospital IT companies where we are getting data from them and we are building products with them which they will be selling and we have a revenue share agreement with them.
This brings us
to our team. I am finishing my PhD at Columbia in biomedical engineering.
My co-founder Alex
finishes master's at Columbia in data science.
He's full-time
in the company. He takes care of operations and sales.
He was at
IBM before where he built big data products and was selling them to enterprises.
Harshit,
a
very advanced developer.
He is full-time in the company as well. He graduated from Columbia from computer science. He was at GE Healthcare before and Oracle before. He built enterprise-wide software with multiple integrations in highly complex settings.
Tasha, our CTO,
she works with Microsoft Research and she's one of the few people in the world who actually tries to understand artificial intelligence rather than just implementing it.
Deep is our security expert.
It's a very complicated space and a lot of regulations. Deep has done security for some of the biggest keyboard companies in the country. He has done security for some of the biggest financial institutions in the country. He is full-time in the company and takes care of our security, for our data and so on.
We want to
bring in chief of medicine. We have identified a few people. We have been working with them for a very long time and they should be joining us late summer. We are also working with a lot of salespeople, a lot of expertise in the market, and we will be training them onwards as we move on.
Some of our advisors, scientific advisors, we are not doctors and we understand that. We have been working with doctors throughout the life of the company. I cannot thank these advisors enough. These are people who have advised us on each and every step how to not only develop the technology, but also how to create value in the workflow of each and every doctor inside the hospital. We won several technology and business competitions that have actually fueled the company so far. We also raised a couple of convertible notes from some of the advisor and student VCs. We are raising $2.5 million as convertible note for product development and sales activities. Thank you.